to this week's Knowledge Nibble, where we will discuss the different types of ultrasound therapy for animals. Okay, so first we're going to have a think about what ultrasound therapy is. So ultrasound therapy is a sound wave. You could argue it's not strictly an EPA, or it's not strictly an electrotherapy, because it's not an electrical wave, not an electrical current that is taken up by the tissues. It's a sound wave. EPAs or electrophysical agents is more of a more recent term, and it's more encompassing. But effectively, a sound wave is obviously not an electrical wave. What a sound wave is mechanical vibration. So sound energy is mechanical vibration, and a sound wave is a longitudinal wave. So if we just look at this little image here, we can see that this tuning fork is sending out a sound wave, and it's traveling its way along in a straight line along this wave. So what we get within an area, a longitudinal wave, a sound wave, we get areas of compression and rarefaction. So that's, I basically like to think about this as areas where it squashes together and then it opens out again, it squashes together and it opens out again. Now between each of these between two of these compressions is one cycle. So if we look at this in a traditional wave shape that we think of, between two of these compressions here and rarefactions, we get ourselves one cycle. And it's the amount of cycles per second which dictates the frequency. So in therapy, the frequency that we most commonly use is between 1 and 3 megahertz. So that's 1 million or 3 million of these cycles per second. So that's just a quick overview of where the frequency comes from. So if we think about hearing, we can imagine these compressions, rarefactions moving along a wave and then hitting our eardrum. When they hit our eardrum vibrates at a certain frequency, and we pick that up as sound. When the sound wave goes above that frequency, it becomes ultrasonic. So we can no longer hear it, but it's still there. And what we're wanting to do in a similar way, I suppose, is we want to get that sound wave into the tissues and cause this vibration, this agitation, if you like, within the tissues. And so what we're looking for is molecular agitation or oscillation. So when these molecules are not moving along necessarily, they're staying within their position, but within that position, they're oscillating, they're moving around, and they're getting excited. And then we're going to get cellular upregulation, which is what we've discussed before, alongside other benefits. A lot of the electrophysical agents do the same thing or do a very similar thing to the tissues. Really, it sort of comes down to how deep they go, what tissues they interact better with or get absorbed into. That's where your sort of selection of what modality you would use. But the actual effect or physiological effect within the tissues is quite similar between the different modalities. So this is where a lot of people get stuck when they're first learning to use ultrasound, is the variables that we have on the machines and actually how to select the dose. So this is very important. This is why you need to train on it and you need to learn about it, because it's very important, the dose that you select. So you'll have some people say, oh, I had ultrasound for my dog or my horse, and it didn't work. Well, it might have been that the dose, it should work. If we look at the literature and we look at the injury you have, it should work. If it didn't work, there can be obviously other reasons why, but it may well be that just the right dose was not selected. And also, obviously at the more severe end of that scale is if you miscalculate the dose, you can cause some damage, and that's obviously not something that we want to do. So I'll just explain quickly these different variables that can be used when you're setting up an ultrasound machine. So if we look at the frequency, we're going to be between 1 and 3 megahertz, as I've already mentioned. There are some machines that are at 45 kilohertz, and they will be long-wave ultrasound machines, but the majority of the machines that you will find and the majority of the literature that you will read is on this frequency of 1 to 3 megahertz. But that's not to say that this 45 kilohertz frequency doesn't exist, and I know some of you may have a long-wave ultrasound machine. They are out there and they are being used. So the effects, if you like, are very similar. It's just the frequency that's different. And so the reason when we're looking at frequency, so normally when you're setting up a machine to give a treatment, you will be asked to select the frequency 1 or 3 megahertz on most machines. And this relates to how deep you want to how deep the lesion is and how far you want to penetrate with the ultrasound. 1 megahertz is generally around 4 centimeters. There's a lot more to this actually that is covered in our course on therapeutic ultrasound, but let's just keep it simple here. About 4 up to 5 centimeters, possibly 6. But if you want if you select 1 megahertz, that's the sort of depth that you're looking at. And then if you want to be more superficial than that, up to about 2 centimeters, you're going to want to select 3 megahertz. Once you've selected the frequency then, so how deep do I want this to go? You're then going to think about what type of beam you want to use. Is that going to be continuous or pulsed? So is it literally just going to be one continuous beam, sound wave, or is it going to be pulsed? So switched on, switched off, switched on, switched off. The questions we're going to ask ourselves to try to decide what we need to select there is how severe or what stage of repair we're at. So are we acute? Are we subacute? Are we chronic? The continuous beam is more associated with the thermal effects of ultrasound, but if we start to pulse that, we get less heating, and we're thinking more about the non-thermal effects of ultrasound. You will always get some heating. The fact that you're agitating tissues, you're exciting tissues, you are by default going to get some heat generated, but continuous is going to be a lot more of those thermal effects. So that's something that a question we're going to ask ourselves: how severe it is, and whether we want to use a continuous or pulse beam. Now, if we decide we want to pulse the beam, we then need to ask ourselves at what ratio we want to pulse that. This again will come down to how severe it is, what stage of repair you are in. You will decide if you're further along that between acute and chronic. You may select then a pulse ratio that will pulse that beam at a certain duty cycle. And again, this all comes down to your clinical reasoning and your understanding of what level or what stage we are with that repair and how severe the condition is. I won't bore you too much about how this works, but just really briefly, for example, some manufacturers show a pulse ratio and some people show it as a duty cycle. So a pulse ratio of 1 to 3 would be the same as a 25% duty cycle. What that means is out of 8 milliseconds here, so 2 milliseconds, the pulse would normally be on for 2 milliseconds. So if it's on for 2 and it's off for times 3 of that, it would be on for 2 plus 6 would be 8 milliseconds. In the same way, that can be shown as a 25% on and 75% off. Don't worry about that too much. That's just thrown in a bit of confusion there for you, but it is something you do need to understand if you are going to use ultrasound. You don't need to really understand it just for this, the purpose of this talk. Okay, and then the next thing would be the intensity. So this is again, we're considering the severity or the stage of repair. So how powerful is that? How much power do we want to put in? How intense do we want that treatment to be? And then just finally, then we would want to select the time of the treatment. There is a formula for this. It comes down to the size of the head, transducer head that you're using, the size of the tissue that you want to treat, and then whether you pulse the beam or not. So just for an example, if you decided, right, I want 10 minutes because of the size of the tissue, I need to deliver 10 minutes of treatment. If you are pulsing that 1 on, 1 off, you would need to double that length. So that would need to be 20 minutes in order to get the same amount of ultrasound ultimately into that tissue. Again, there is a formula for this. If you decide, we are running a series this year of courses on electrophysical agents, and the first one is actually available now, which is a photobiomodulation course, and that laser course, and that is available now at an early bird discount at the time of recording this, and that is the first one in the series. The next one will be ultrasound, and if you decide to study that, then we do go into this in a lot more depth. Appreciate you might think, well, there's a lot to learn here, but it does all become clear in the end, I promise. Okie dokes. So next we need to think about the transmission. So what does this mean then? So this is a transmission of the sound wave through the tissue. And there's a thing called acoustic impedance, and that is the opposition of the flow through the tissue. So how resistant is the tissue to the sound wave? And there are different impedance between different tissues. So some it will flow through more easily, some it will just hit and not be able to flow through. What we're looking at when we're applying ultrasound, what we would ideally want is that if we're going between one tissue to another, or in fact one medium to another, it doesn't have to be a tissue, but if we were traveling from one medium to another, we would want the impedance to be as similar as possible. And that would mean we wouldn't get much disturbance, it would flow through. Now, obviously, we can't dictate that. And what happens then if we go from two very different tissues or two very different mediums, when the sound wave travels through, it just reflects back. So if we get this impedance, this change in impedance, we get a lot of reflection. And that is a problem that we have with ultrasound. We know it's very well and good, and we know it works when we get there, but how do we get it into the tissue? And so the first place where we need to overcome this would be just simply from the transducer to the skin. And that's why we use a coupling medium. So we'll use a gel. Mostly in animal therapy, we use a water-based gel. And the reason why we need to use that is because the difference between metal and air is quite significant. So as soon as the sound wave comes out of the transducer, if there's nothing to couple it and it hits the air, it will just reflect back. Almost 100% of it will reflect, so it won't go anywhere. So what we need to do is encourage that to pass through and into the tissues, and the way we do that is by using a coupling medium. So effectively, if you don't use a coupling medium, it won't go in, and you won't get any therapy from it. So that's the first place. But then, of course, once it goes into the tissues, we have the problem of the tendon, ligament, skin, fat, muscle, whatever we're going through. We're going to have these different reflections going on. And what we need to also think about then, moving on, is absorption. So different tissues will absorb ultrasound at different levels. Some it travels through without being absorbed, things like blood. Then the tissues that are more dense and collagenous, it will get absorbed better into. And this all comes into, what am I going through, and how much energy do I need to put in at point A in order that at point B, which is my lesion, I still have enough energy left to actually do anything. And again, this all comes into your dose calculation. Oops. Right. Okay. So let's just have a look then at what sort of tissues it's absorbed into. So I've already mentioned that it prefers dense collagenous tissue. So ultrasound is going to work well and be well absorbed or better absorbed into tendon and ligament, into fascia or any connective tissue, scar tissue, joint capsule, that type of thing. If we have a look at this, just some dinner here. I thought this might be a better picture to use rather than a dissection picture, which might have shocked some people. So here we have what we would have on the outside of this. It would obviously be skin, hair, skin. Then we're going to be looking at fat. We're going to be looking at fascia. Then we're going into muscle. We've got layers of fascia, connective tissue in the muscle. Then we come down to the bone level. We're going to have some tendon around here. We're going to potentially have some ligament here around the joint and joint capsule. And then we've got the bone where we're going to have the periosteal surface, which you can see shiny here, and then into the bone. So in theory, I mean, in truth, it wouldn't go this far through to get to this bone. So if you wanted to get to this bone, you're going to have to come you wouldn't want to get to the bone, but if you were wanting to get this tendon, say, for example, you'd have to come from a different angle, which might be quite difficult. So you're not in real life actually going to travel this sort of depth through this muscle here. So what about cartilage and bone? If we're thinking about a dense collagenous tissue, high protein tissue, well then surely bone and cartilage are going to be good for that and it's going to be absorbed. So why can't we actually get it into the bone using sort of your general shortwave ultrasound machine, which is what we've been discussing up till now? So if we move on, we can think about LIPUS. You might have heard this as LIPUS, or low intensity pulsed ultrasound. So this is the same frequency. This is a different piece of equipment. So you cannot deliver low intensity pulse ultrasound with your normal shortwave ultrasound machine at the moment. Who knows, maybe they'll get them into one at some point. But so a low intensity pulse ultrasound machine, the main use for these are for non-union fracture repair. Okay, so the picture, this dog in this picture was, we were looking at amputation, and a non-union fracture just would not repair, and we used this for, the thing is with LIPUS, it has to be used for months, but this fully repaired. Which was very exciting. So it's a really, really exciting treatment. And now, so the difference is, it's set at about, most of the machines are set at, well, there's only a few machines that deliver it, but they're mostly set at about 1.5 megahertz. So we're between that 3 and that 1. But the difference is it's a much, much lower intensity. So that power, that intensity that it goes in is much, much lower. Because what happens, unfortunately, when we're firing ultrasound in, you think, well, why won't it just go into bone then? Well, it hits the periosteal surface. The tissues are very different as far as that impedance is concerned, and it just reflects off. So although we know it'd be great if we could get it in there, we just can't get it into the bone. But if we deliver, it seems, at this very much lower intensity, it can get into the bone. And when it gets in there, it does some pretty cool stuff. So it is a little bit different, though. We do need to use it for 20 minutes a day. And it can go on, this can go on for months. I think this dog we treated for 5 months, 4.5, 5 months. So it's a commitment, and it's quite an expensive treatment. But if the other option is to have the limb off, then it's obviously, quite exciting and worth a try. So the probe is held in position, and that's because the machine has to have a thing which is low beam non-uniformity ratio, BNR. It's too much for this lecture, but what that means is it's safe for the probe to be held still. So normally we have to keep moving the probe. It has to keep moving to reduce the chance of overheating or hot spots. With this low intensity ultrasound, we don't need to do that. So just a little recap then. That's it for today. So just a little recap. You've got your shortwave ultrasound between 1 and 3 megahertz, which is your most used. You've got then long wave ultrasound, which is 45 kilohertz, which is all about the same thing as the shortwave ultrasound, but it's a different frequency. And then the other type of ultrasound that you will see is this LIPUS, this LIPUS, low intensity pulse ultrasound, which is currently being used for fracture repair. It probably will be good for other stuff, but at the moment, that's what it's being used for. So if any of you have any of those cases that have got that horrible non-union fracture going on and you just can't get a repair, I highly recommend you give LIPUS a try. Okay, so your actions then for this week. If you have an ultrasound machine, again, I've said this before for different pieces of equipment, review the settings, review the literature, make sure you know what you're doing and the dose that you're selecting and the protocols that you use are correct. And then second of all, either if you do or if you don't have an ultrasound, a second point would be to revise fracture healing, particularly non-union fractures. So if you did want to go on and study this a bit further, you do have more of an interest in LIPUS and how that can work, and how you might be able to use it. It'd be fundamental that you understand fracture healing and non-union fractures, so that you know if you're using a LIPUS, you can study the literature on that and understand how it's actually working. Okay, so I've overrun as per usual for today, but I hope you enjoyed that Knowledge Nibble. If you're not signed up to Knowledge Nibbles and you'd like to be, then you can do that over at our website, animalrehabhealth.academy/knowledge. Thanks very much. See you next week.